Hello students. Welcome to part 4, chapter 15, weight management. Now we are going to focus on food misinformation and fads. A fad is a widely shared fashion or pursuit. Food fads are scientifically unsubstantiated beliefs about certain foods that may persist for a short time in a given community or society. So the word fallacy means a deceptive, misleading, or false notion or belief. Food fallacies are false or misleading beliefs that underlie food fads. Okay, so now that we have clarified that term, unscientific statements about food often mislead consumers and contribute to poor food fads. False information may come from folklore or fraud. However, empowering individuals to recognize misinformation helps them make sound food choices according to evidence-based nutrition guidelines from responsible nutrition professionals. So, food fads, types of claims. Food faddies makes exaggerated claims about certain type of foods. These claims generally fall into the following 4 basic groups. So we have 4 types of claims. One is food cures. Certain foods cure specific conditions. B, harmful foods. Certain foods cause harm if eaten. 3, food combinations. Special food combinations restore health and are effective for reducing weight, right? And we have many of them in the market right now. And 4, natural foods. Only natural foods can meet body needs and prevent disease. So those are the 4 basic types of claim. Erroneous claims, for example, they seem to be simple statements about food and health. However, further observation reveals that they focus on a food itself and not on the specific nutrients that are in the food, right? So, for example, we have wheat bread, right? And they are selling the product, so they focus on the food itself. It's a wheat bread, but whenever you go and read the ingredients, you can find cornstarch, you can find different ingredients that are not healthy at all, right? Dangers. Why should healthcare workers be concerned about food fads and their effect on food habits? What harm do food fads cause? Food fads generally involve 4 possible negative effects. So danger to health. Self-treatment can be dangerous, especially when such action follows questionable sources, right? By following such a course, people with real illness may fail to seek appropriate medical care. Fraudulent claims and of cures have misled many ill and anxious people and have postponed proven effective therapy. Cost. Also, some foods and supplements used by faddists are harmless, but many are expensive. Okay, then we have lack of sound knowledge. And also distrust of the food market. People should be watchful of their food environment, but a blanket rejection of all modern food production is unwarranted. Basic line here, the summary is to read the ingredients. I will suggest in order to avoid all these factors. Be a master in reading your labels. So, and be a master to understand if you see a term that you don't know what is it. Usually it's a chemical term, right? Or a term, the name of a preservative. Google it. Okay, so you know exactly what this ingredient is for, what is the purpose, and how it's going to damage, or maybe it's going to be harmless to you. So basically read your ingredients. What is the answer? So you need personal conviction, practice, and enthusiasm in order to avoid misinformation and to start looking and doing your research, your Google search or any type of search, to be familiarized and to have knowledge about what you are eating, what you are selecting, what you're putting in your shopping cart to go home. Using reliable sources, know the product being pushed and the people or company, know how human physiology and biochemistry work, know the scientific method of problem solving, collect the facts, identify the problem, determine a reasonable solution or action. So for example, when you buy supplements, okay, look for supplements that are third party tested. Okay, third party tested. If they are gluten free and organic, much better. Don't buy any type of supplement without these recommendations. That's it, basically to be safe. Okay. Sound community resources include the following: extension educators work in the community through state and county extension services offices and direct highly successful community nutrition activities such as their expanded food and nutrition education program. Also, the FDA and US Department of Agriculture produce many free educational materials related to food and nutrition. Yes, but also I will strongly suggest you not only these, because we have many products that are imported and we have many products that are approved to be sold in the market, but you want, especially in terms of supplements and minerals, vitamins, to be third party tested. Okay, third party tested, and also they have the symbol of organic and gluten free. Okay, public health nutritionist and registered dietitian located in county and state public health offices as part of the special programs can provide information, and also these nutritionists in local medical care centers who serve hospitalized patients, outpatient clinics, and private practice also are valuable resources. Yes. So now recognizes human needs, especially the emotional needs that food and food rituals help to fulfill. Human needs also maintaining a balance between food as entertainment and food as fuel is the challenge of identifying the role of food in relation to human needs. So yes, this is very important. It's extremely important to make the difference, right? Between I am eating for entertaining, like when I'm going to the movie and I'm buying popcorn, or if I am watching the Super Bowl, right? I'm going to prepare a tray full of fried wings, and that's not really healthy. So make the difference between what you need to eat, what you're eating for entertainment versus what is the role of food in relation to your human needs, right? Use any opportunity that arises to present sound nutrition and health information, whether formally or informally. I've seen many of you, the students, who are snacking before exams, and I see you drinking sodas and eating French fries, snacks, different types of snacks, right, that are not healthy, just to relieve some anxiety. Thinking scientifically. Even very young children can use the problem-solving approach to explore everyday food behavior choices. Children are naturally curious. With their eternal questioning why, they often seek evidence to support the statements that they hear. 3 basic questions help with the evaluation of claims in any situation. 1 is, what do you mean? 2, how do you know? 3, what is your evidence, right? So here in this box, the Food and Nutrition Science Alliance 10 red flags of junk science. So if you read the recommendations are a promise to a quick fix, that's a red flag. Claims that sound too good to be true, right? Recommendations based on a single study. In these claims that sound too good to be true, I will include those injections that are promising weight loss on patients that are having diabetes or obesity. Recommendations based on a single study. So recommendations made to help sell a product, recommendations from a study that ignore difference among individuals or group. Yes, in this category, the last one, number 10, I will suggest in general, right? How in healthcare we are treating patients with hypertension the same way. There is an algorithm of treatment, right? So you start with lifestyle changes, like reduce your salt intake, change your diet, and then you increase diuretics, and then you increase to hypertension medications. They don't care if the patient is having any other type of comorbidity. They just follow an algorithm. So you see, they ignore differences among individuals or groups. The same thing is going to happen if you start buying supplements and vitamins and minerals without going to the doctor and getting your blood work to see what you really need. It's not what your neighborhood is using and is effective for that person. You need to have evidence. So the Food and Nutrition Science Alliance is a partnership of 7 professional scientific societies that have joined the Disseminate Sound Nutrition Information. This organization issued a list of 10 red flags to help guide consumers towards making educated decisions about nutrition and health issues. So there you go. We already reviewed the 10 flags. Knowing responsible authorities, we know the FDA is legally responsible for controlling the quality and safety of food and drug products marketed in the United States. But you need to recognize also, and you need to remember, that we are millions, hundreds and hundreds of millions. Of the FDA need to hurry up, speed up the process to approve certain supplements, food, in order to, cope with the amount of people. So the best thing is you as an individual master how to read your labels, master your knowledge, and look for, in terms of third-party tested or organic or gluten-free products, supplements, minerals, and vitamins. Let's talk about the underweight, general causes and treatment. So general malnutrition and excessive thickness is a less common problem in developed nations than overweight and obesity. Yes, and it does occur, and is usually associated with poor living conditions or long-term diseases. It's very sad. An underweight person is someone who is more than 10% below the average weight for a height and age. So it's 10% below the average weight for height and age. Someone who is more than 20% below the average weight has cause for significant health concerns. Okay, so this is a factor that we have to remember. I'm having issues here. Then 2 concerns. Okay, very good. So it's 10% below the average weight for height and age. Someone who is more than 20 below the average has cause for significant health. It's very sad. Causes: wasting disease, long-term disease with chronic infection and fever, poor food intake, malabsorption, poor nutrients absorption that result from chronic diarrhea, a disease, gastrointestinal tract, the excessive use of laxative, hormonal imbalance like hyperthyroidism, low energy availability, and poor living situation. Those are the causes for underweight. Dietary treatment, special nutrition care to rebuild body tissues and to regain health is necessary for underweight and undernourished clients. So the goal, in accordance with each person's tolerance, is to increase energy and nutrient intake based in accordance with each person tolerance. That's why, again, all treatments must be individualized, not using a general algorithm. So energy and nutrient dense diet above the standard requirements relative to age and sex standards. We have high protein to rebuild tissues, right? High carbohydrates to provide the primary energy source in an easy digested form. And here we have to think about diabetics. Okay, we have to be careful with diabetics. Again, these treatments must be individualized, no following a standard algorithm. Moderate fat to provide essential fatty acids, especially on patients that are having history of cholecystitis, cholelithiasis, right? We have to be careful with that. Anybody who is having atherosclerosis or problems with the heart. So we have to make a balance there. Good sources of vitamins and minerals. So nourishing meals and snacks composed of favorite food as well as high variety of foods attractively served may help to revive the appetite and increase the desire to eat more. Yes, we can also use different spices, right, to make the food more tasty. To gain muscle, physical exercise might be part of the treatment. Resistant training increases lean tissue and in turn boosts appetites. Good. Now, clinical applications, problems of weight loss among older adults in long-term care facilities. So one of the problems that we encounter in this is the low body weight and rapid and intentional weight loss. They are a sensitive indicator of malnutrition that can contribute to illness and death. And basically, there is an emotional component here in these long-term care facilities. In general, the following can cause weight loss in this population. One, the physical effects of the metabolic changes of aging. Yeah, that's something that is there. We cannot do anything about aging, right? Two, the physical effects of disease. The patient is coming with specific comorbidities. Three, certain factors that alter the amount and type of food eaten. Physical disease, example, cancer, can cause extreme weight loss because of metabolic abnormalities, taste changes, especially if they are receiving chemotherapy. There is a change in the taste as a consequence of medication. Loss of appetite, nausea, and vomiting, all consequence of medications, right? Other diseases that affect weight include gastrointestinal problems, uncontrolled diabetes, cardiovascular disorders, congestive heart failure, pulmonary disease, infection, alcoholism. Psychological factors or psychiatric disorders may also contribute to malnutrition and weight loss from depression, dementia, disorientation, apathy, and appetite disturbance. And this is related to the mental state, right? Lack of visitors in the long-term facilities, loneliness, right, lack of interest because they are at the end of their life, so they are not interested in keep going. Nutrient deficiencies, low levels of folate and B-complex vitamins, especially if they are having problems in the gastrointestinal, as well as protein energy malnutrition can cause altered mental states, right? So if they are in a nursing home or long-term facility, they don't have the budget to provide enough protein daily. So that's going to be the consequence. A specific nutrition support can correct these conditions. The following additional physiologic, psychological, and social factors may influence food intake and body weight and thus contribute to malnutrition in the elderly. For example, body composition changes, and we have to remember there are 4 components. We have the fat, the water, the muscles, and the bones, right? The body composition. Constant attention to fluid intake also helps with the common problem of xerostomia, which is dry mouth. You don't want your elderly patient to have dry mouth. Okay, so xerostomia results from inadequate salivary secretion, which makes eating difficult, thereby contributing to malnutrition. Taste changes, yes. Even though if you don't have any, if the patient does not have any comorbidity, when as we age, the taste is going to change, right? Remember, your grandma used to cook delicious when she was 50, and now she turns into 90s, 100, and she's not identifying if the food is having enough sodium or salt, right? Dentition, gastrointestinal problems, lack of appetite. This is a consequence of gastrointestinal problems. A decrease in gastric secretions, including hydrochloric acid, may hinder the absorption of protein, B12, folate, and iron, thereby contributing to anemia and loss of appetite. Constipation is a common complaint because the patient also is not drinking water, is not walking, is eating poor fiber. So an increase in dietary fiber, liquids, and physical activity can help to provide a more natural approach to establishing normal bowel movements. Drug-nutrient interaction. Elderly people often take a number of prescribed and over-the-counter medications, multiple, right? As we age, we start collecting all type of bottles around our tables, right? Supplements, vitamins, minerals, medications, you name it. We need another table because one table is full of bottles, right? Some of which are the direct cause of anorexia, nausea, and vomiting because the interaction among drugs and supplements, vitamins, you name it. Functional disabilities as we age, right? Problems to move, problem with the putting food into the mouth and swallowing, right? Those are functional disabilities. Social problems, socioeconomic, especially trained geriatric social worker can help to secure possible sources of financial assistance. And as I mentioned before, social isolation is one of the factors. So disordered eating, we are entering a zone that not also includes, because we just review the aging, the elderly population. We are entering a zone for the young population, okay? So normal eating is when an individual is capable of eating when he or she is hungry and stopping when full, right? Demonstrating moderate restraint with regard to food selection, recognizing that overeating and undereating are sometimes acceptable, and trusting his or her body to establish a balance. This is important, trusting his or her body to establish a balance, okay? One of the most important concepts in disordered eating. Having the ability to be flexible with his or her eating schedule. That's another good important. So disordered eating can range from infrequent episodes to more often, such as with other specified feeding or eating disorder, or persisting enough to meet diagnostic criteria for an eating disorder. We are going to review the diagnostic criteria in a few seconds. The three most common eating disorders are anorexia nerviosa, bulimia nervosa, and binge eating disorder. So here we have a table, okay, for the diagnostic criteria, and we are going to hold on this table and then we're going to come back. Okay, so the Academy of Nutrition and Dietetics describes eating disorders as psychiatric disorders with diagnostic criteria based on psychologic, behavior and physiologic characteristics. I would say in that order. So the diagnostic criteria based on psychologic, behavior, and physiologic characteristics. Okay, remember the gastrointestinal is the second brain in the body, is the beginning of all illnesses. Okay, so psychologic factors are extremely important. So anorexia nerviosa has the highest premature death rates of any psychiatric disorder, anorexia nerviosa. Individuals with anorexia are 2.8 times more likely to die from all-cause mortality and 3 times more likely to die by suicide than other females in the general population. Okay, psychiatric disorders. So when I recommend you in class to take care of your mental state, to regulate your anxiety, your depression, to follow a course for stress management, I am not joking. You are entering a field in which you are going to put more weight on this psychological factor in your life. So if you're already having anxiety and stress and depression, once you start working on nursing, okay, the type of cases you're going to see are going to build up on top of your personal history. If you cannot handle your personal history factors, right, you're gonna be burned out in a couple of months, not even 1 year. Okay, so additional psychiatric comorbidities, especially those related to substance abuse, have more pronounced rates of deaths. So there are patients that are recovering from substance abuse, right? They already recovered. I've seen many students recover from that. and then they were successful, and then they are still having some anxiety and stress and depression. They enter the nursing field, and then because of the cases they see, they go back to the substance abuse. It's very painful, very sad. So eating disorders occur less frequently among males than females and often involve a muscularity-oriented body image, and disordered eating patterns aim to achieve a muscular ideal rather than the thin ideal common among females. So eating disorders, risk factors include the following: sociocultural influences, personality traits like negative emotionally, anxiety, anger, perfectionism, overeating, dieting, negative urgency, impulsivity, especially when distress inclines specifically with bulimia nerviosa and binge eating disorder. Neurocognitive processes, decreased cognitive flexibility, motor or cognitive inhibitory control, and serotonin disturbances. So this is a good one. I will highlight this even. Okay. Child maltreatment. Okay. All types of child maltreatment are associated with an increased risk for eating disorders. Sexual abuse and physical neglect have the strongest relationship in females, whereas sexual abuse and emotional abuse were the strongest among females. Let me highlight this one once again. Okay, so now we are going to continue with the 9 truths about eating disorders. So we have people with eating disorders look healthy yet may be extremely ill. Okay, I would say that when you suspect somebody's having an eating disorder, you pay more attention to the psychological behavior. Okay, so you see somebody that look healthy, but it could be extremely ill. Pay attention to the way they behave. Okay, families are not to blame and can be the client's best allies in treatment. We are talking about 9 truths about eating disorders. 9 truths. So disrupt